Yeah, Tivozanib is currently FDA approved for patients with clear cell kidney cancers who've had two lines of prior therapy. We do have some subgroup analysis looking at patients with non-clear cell kidney cancers. It sounds like the objective response rate is about 37% or so. The disease control rate is about 70%, so pretty potential activity with Tivozanib in non-clear cell histologies. Nivolumab is pretty active in kidney cancers in general, and we do have pretty good data suggesting that both a combination of TKI plus Nivolumab may be promising in non-clear cell kidney cancers. So that's the rationale for this study. Yeah, this study is enrolling all patients with any type of non-clear cell kidney cancer histology. We are excluding patients with renal medullary tumors and collecting duct tumors, since they tend to behave a little bit differently than the other types of kidney cancers, and they are treated differently too. So we're looking at papillary chromophobe histologies, oncocytic, and other subtypes as well. There's some, based on the subgroup analysis of Tivozanib by itself, we do think that potentially papillary and maybe even chromophobe histologies may potentially respond, even though the analysis for that one showed pretty small numbers overall. So we'll be looking to see if that's effective. So the BOP2 design is designed to look at efficacy and safety in 12 patient cohorts that are enrolled. We are enrolling a total of 48 patients. So in the first 12 patient cohorts, we'll be looking for activity and also safety analyses. So we have pre-specified boundaries for those analyses. Once we meet the efficacy and or the safety toxicity analyses, then we proceed with the additional 12 patients. We do have additional pre-specified efficacy and safety endpoints, and then it keeps going until 48 patients are enrolled. So for kidney cancer, and specifically non-clear cell kidney cancers, we haven't done a great work of looking at biomarkers for kidney cancers, and looking at predictive biomarkers in particular. So we will be looking at proteomic analyses, looking at IHC staining for PD-L1 and others, also looking at the tumor microenvironment as well. And also we'll be hoping to send this tissue for genomic sequencing to find novel biomarkers and mutations that might be predictive of responses to this combination. So this study has already started enrolling as of earlier this year, so it's pretty new in the process. So we're looking at 4 different sites, MD Anderson, University of Michigan, UC Southwestern, and potentially other sites as well. So it's still ongoing right now. It's obviously very difficult to enroll non-clear cell kidney cancers given the rarity of the disease. So we're hoping by the 2-year mark we'll have reached our target accrual. In terms of interval analyses, that BOP2 design I mentioned earlier, that will give us an earlier signal to see is it working in the first 12 patient cohorts, and then so we'll hopefully get the signal with that first stage of the analysis.